Thank you very much, Professor Tariamuchi, and hello everyone, good afternoon. My name is Mahmud Aditya Rifqi. Yes, my name is Mahmud Aditya Rifqi from Department of Nutrition and Health, Faculty of Public Health Center. I'm also part of the Center for Health and Education, Nutrition Education, Counseling and Empowerment from Airlangga University, Indonesia. So today I will present our ongoing research on the title Integrated Approach of Nutrition and WAS to tackle malnutrition issues in urban slum, Indonesia. Here is the outline of my presentation. There are three parts. The first part I will explain about our research regarding water sanitation and hygiene, especially the effect of hand washing or the reduction of Escherichia coli on children's hands in urban slum Indonesia. The second part, I will discuss about nutrition side, assessing dietary intake of children and adolescents in urban slum Indonesia. And the last part, I will explain about our ongoing research, integrated approach on nutrition and water sanitation hygiene to tackle malnutrition issues in urban slum Indonesia. I will begin this presentation with the terminology of urban slum. So urban slum families are those living in urban areas predominantly characterized by poverty and insufficient living space. The crucial aspect of urban slum is that residents face limited access to clean water, sanitation facilities, and low awareness of hygiene practices. Our previous studies have indicated that this condition, coupled with the contaminated environment, contribute to the disease like diarrhea and malnutrition, emerging yet overlooking. So it's prevalent, but the case often tend to be overlooked, and particularly in developing countries, including Indonesia. So the WAS approach is crucial for the population in slum areas. Previous research indicate that the WAS approach can reduce the disease around 10% in the community. This aligns with the SDGs target, especially point 3 and 6, aiming to achieve good health and well-being, as well as access to clean water and sanitation. Diarrhea and malnutrition are the two main challenges haunting the younger generation in urban slum, and unfortunately the comprehensive focus on children and WAS studies is still overlooked. This map shows the population density across Indonesia. So this is map of our country, Indonesia. The darkest areas on Java Island, especially Bandung, Jakarta, and Surabaya, indicating the highest densities. Java has over half of the country's population, despite its small land area. So we focus our study on Bandung and Surabaya to explore how high population density affect malnutrition and public health challenge. This slide shows the trend of child stunting in Indonesia over the past decade. Although the overall stunting rate has decreased from 37% in 2013 to 21.6% in 2022, progress remains uneven. So the Indonesian government has implemented several initiatives to tackle the stunting issue, but the impact has not yet been effective enough to significantly reduce the prevalence of stunting. So our research, here is the research coalition of our research. First, how does regular hand washing affect the reduction of Escherichia coli contamination on children's hand in urban slum? And what are the dietary intake pattern of children living in urban slum area, and how do this pattern relate to their nutritional status? And how can integrating nutrition and WAS intervention help to reduce malnutrition and improve health outcomes in urban slum communities in Indonesia? Then I will explain about the study one, first and second study. So this research was conducted in Bandung and Surabaya, as I mentioned earlier, the two most populous cities in western part of Java and eastern part of Java. These cities have several urban slum areas where communities continue to face challenges, particularly regarding access to clean water, wash facilities, and overall environmental conditions. So we can see the picture. This picture illustrates the condition in the urban slum area, where the people live around a waste disposal site. Schools are situated near the waste disposal site, as well as the children eating area. And additionally, residents often live near polluted rivers and waste disposal sites. So this situation depicts the vulnerability of children to the risk of contamination from the environment. Our first study focused on the hand washing and the reduction of E. coli. We found that poor hygiene practices and limited access to clean water contribute significantly to bacterial contamination, particularly E. coli, which indicate fecal exposure. So this is the method of the study to understand the effect of hand washing on E. coli. On student hand, we conduct microbial detection for pre and post hand washing. Following the swab test, the sample were analyzed in the laboratory using enzyme substrate method. So in this image, the blue colored colonies indicate E. coli bacteria. Here is the result of our study. Before hand washing, E. coli was detected in 89% of students, with a concentration 1.8 log 10 coloniform unit per hand. And there was no gender difference in the study. This result consistent with the several studies stating there is a high bacterial exposure on children's health in urban slum area, especially in low and middle income countries. This indicates that living in slum area increase the risk of exposure to E. coli, especially in children. This graph illustrates the concentration of E. coli on children's hand before and after hand washing. So the percentage of children detected with E. coli on their hand decreased from 89 to 49%. So this was a question about the effectiveness of hand washing in reducing E. coli on children's hand, depending on the method used. The detection of E. coli on almost 50% of children despite hand washing suggests that the practice is effective but not sufficient effective in eliminating E. coli on their hands. We compare E. coli reduction with the amount of steps during hand washing. As we know, the step of hand washing from WHO. So the grouping of this step comes in based on the reference from previous study, and the study found that washing hand with 3 steps or fewer cannot significantly reduce the amount of E. coli compared to 4 steps or more. So this is, we did hand washing observation, referred to modified WHO guidelines. This image describes the part of the hand that are often overlooked during hand washing. So children tend to focus on washing easily visible part, like such as palm and back of the hand. However, the study found that there are some crucial parts that are often forgotten, such as space between fingers and fingertips, and these parts are not easily visible, so they are often overlooked by children. So the high exposure of E. coli on children's hands in urban areas align with several studies where the contamination from poor environment influence cross-contamination. And additionally, children tend to spend more time engaging in outdoor activities. Next, I will explain about our second study. The second study focused on nutrition area, assessing dietary intake of children in urban slum area. In this study, we assessed the food intake of children. We found that in urban slum setting, children face double challenge: limited access to nutrition food and poor sanitation. So our findings indicate that when dietary diversity is low, and hygiene practice are inadequate, the risk of malnutrition increases significantly. This table shows the association between protein intake and stunting among children based on Indonesian recommended dietary allowance. As we can see, 41% of children had insufficient protein intake, and this group had a significant higher prevalence of stunting compared to those with sufficient protein intake. So this indicates that many of the main food provided to children contain less protein than recommended, which might negatively affect the growth and nutrition status. The next study from our research group, we assessed the dietary diversity among stunted children and found that the variety of food consumed also played an important role. As shown here, fish consumption was significantly associated with stunting. So children from households that didn't consume fish in the last 24 hours had a higher likelihood of being stunted. So this suggests that limited access to diverse food, especially protein-rich food, particularly fish, contribute to the poor growth outcome among children in low and middle income countries. So insufficient protein intake shows a significant association. Protein play a vital role in muscle and tissue development, immune function, and cognitive performance. So many children in urban slums consume low in protein due to limited access to animal-based or high-quality plant protein. So improving dietary diversity and ensuring affordable protein source are essential to support healthy growth and prevent stunting. The last part, I will explain about our ongoing project, Intervention Study Integrated Approach of Nutrition and WASH. We did intervention study. We conduct intervention study to evaluate the effect, the combination of WASH and nutrition. The program target children and mother living in urban slum area. The intervention lasts for 12 weeks and involve two groups, intervention and control group. So here is the program module. For the first 6 weeks, we focus on WASH, like introduction of WASH, hand washing with soap, and personal hygiene and practice. And in the last 6 weeks, we focus on nutrition, like balanced diet and dietary diversity, protein-rich food, and also understanding malnutrition. So this is the result of our study. Baseline result show that limited understanding of hygiene, safe water, and balanced nutrition. After 3 months, hand washing knowledge increased, nutrition knowledge and on protein and food diversity also increased. Participatory learning, games, poster, demonstration were key to engagement. Here is the conclusion of our study. Malnutrition in urban slum is influenced by both dietary inadequate and poor WASH. So combining nutrition education, dietary improvement, and hand washing intervention can produce stronger health outcome. So we need to integrated community-based program can sustainably address both undernutrition and infection-related health disease. Here is the take-home message for this presentation. Specific education involving simple and specific part require role of teacher, mother, and family. Before I end my presentation, I would like to briefly introduce my institution, Faculty of Public Health, Universitas Airlangga. So here is our department. Please come to Indonesia and let's work together to make greater public health impact. Thank you so much.